Good morning. Today we have with us Dr. Raj Warrier. He is a very eminent and senior pediatric hematology oncologist from US. Sir has also worked as a vice chancellor and one of the mentors of the pediatric hematology department in KMC Manipal some time back. So we'll have an interview with Sir regarding a few questions. So, sir, for over the last 2-3 years, there has been a lot of effort from the INPOG side regarding to raise the awareness as well as improving the cancer care among pediatrics. So, would you like to share with us your experience about how things were when you started out in Manipal as a head pediatric hemato-oncology, and how it is now when you have been through a lot to various centers in India with respect to a few things like the availability and acceptability of comprehensive care, like the improvement of outcomes in India over the last 10 years, and what we should do further to almost reach the Western standards. We have a lot of things, but then there is a lot of distance to go, and the lacunae which needs to be addressed. And the next thing is like we have treatment primary options here. Then what about the salvage? We are having a lot more relapses now. So availability of relapse, salvage options, and other things. Would you like to share your experience about them, sir?
Sure. Thank you very much. But before I start, I would like to say that I'm very impressed by your center. It's a lovely facility and very open concept, an excellent subspecialist, a very good lab facility. So I think we need more centers like this for India to do better in care of children with cancer. So I think you're lucky to be working here. It's a wonderful center. Coming back to the care, again, I did hematology 50 years ago. There were very few centers in the country, almost none taking care of pediatric cancers. But now, with multiple centers across the country, including Tata, yours, and RCC in Kerala, a lot of good centers that take care of cancer with children. Our biggest problem in India is that we have very good doctors, very good facilities, but very large population, and also many doctors who take care of leukemia without proper training. So, basic principle is if you have a child with cancer, refer to a center like MVR or RCC or any good university hospital medical center for care, and they should all be put on protocols. So INPOG started about maybe 10-15 years ago. So every patient should be registered on a study, on a protocol, and managed properly. So basic thing is a pediatrician should be taught to diagnose cancer early, refer to a center of excellence. They should follow protocols, follow the patients carefully. As for relapses, every country in the world has got relapses. Transplant will be the first order of treatment, and next will be CAR T cells. You already have got CAR T in parts of India. So if you can't handle the patient, for the next level, they'll get care. So I'm very impressed by the progress in India over the last 20 years. There are many good centers. In Kerala itself, at least there are 3 or 4 good centers for children with cancer available.
Thank you, sir. The next thing is we are very near Wayanad, which has a lot of sickle cell anemia patients. So would you like to share a bit about your experience with prenatal diagnostics as well as newborn screening in sickle cell anemia? Because there are a lot of inquiries from the government side for starting something like a newborn screening, or there are many things in the pipeline which might be very helpful, and places like Kerala are the best place to start a pilot program throughout the country. So would you like to share your experience?
Absolutely. Yeah, I've been a hematologist for 50 years now, and sickle cell is very close to my heart. And as you rightly correctly said, there are parts of Kerala where sickle cell anemia, and 100% essential that all children, including sickle cell, but all children should be screened for thalassemia and sickle cell. But sickle cell screening is quite easy to do. You can do just with a finger stick. You can be done by electrophoresis, and the diagnosis is made at birth. It's a big difference. If you diagnose at birth, you can start penicillin prophylaxis, and the mortality goes down dramatically. I have not seen a patient with sickle cell die in the first 2 years or 3 years for maybe 40 years, only because of newborn screening. So all children should be screened for sickle cell. The diagnosed sickle cell within 2 or 3 weeks on penicillin prophylaxis is seen by hematologists. So Kerala and Malappuram is a great place to start the screening. It's not very expensive. Kerala has got money, you've got doctors, you've got facilities, and you can take a lead from the center for doing that. Okay.
The next thing I would like to ask is something close to your heart, and which you were mentioning today, and a big raging problem we face today in transplants today. Half of our transplants are haploidentical. Hardly we get about 20% of unrelated donors. So would you like to tell something about registries and help motivate people regarding
Okay,
that.
absolutely.
Because what we have seen is certain pockets of India where the coverage of the registries are there, like some parts of Kerala, like mid Kerala or southern Kerala, or maybe Tamil Nadu, Mumbai or Delhi or Gujarat, we get a lot of donors. Somewhere like in East or some parts, we don't get donors for some group of people. So, would you like to tell something about the importance of registering as a donor and the advantages of a full match with respect to a haploidentical? Whatever said and done, whatever the technology progresses, haploidentical is still a complicated transplant, and nothing beats a 10 by 10 donor.
Yeah. So again, this is a very basic philosophy, and even those who are listening today, if you are alive and a young adult and healthy, everybody should get a transplant donor. It's all little buckles. It's free. They come and do it in the hospital. So what you should do as a hospital is have a drive for the city, for the hospital, for the state, and encourage people. It's completely free. Just do a buccal smear, make it register. Anybody in the world requires a donor can be a transplant donor. It's done by bone marrow, done by peripheral blood stem cells, so it's not painful. You can save a life without doing anything at all. So I think education of the parents, family, public is very important. That's where centers like you should be going out of the community, go to church program. That's why probably Kerala, middle Kerala, because a lot of churches become donors. So go to temples, churches, mosques, and get them to be registered as donors because it's totally painless, it's totally free. You can save a life without suffering anything at all. So kidney donor, you're going to lose a kidney. Liver, here you're going to take your blood and it comes back within 1 week, back to normal. Okay. Everybody, including those who are listening, should sign up and be a bone marrow donor. You can save a lot of lives without any harm to yourself. So it's imperative because, as I said, in the US, if you are a white Caucasian, your chance of getting a donor within 6 months almost 70 to 80%. If you're Indian, it's less than 10%.
Thank you very much, sir. So for being with us here and that wonderful talk and enlightening words.
Thank you very much. I repeat again that you need centers like this to be progressive, work with the community. So I'm glad you're doing some social media thing because public have to know that you are here. You're going to be helping them not only treat disease but also prevent disease. So be progressive, be forward-looking, and be community-oriented. Okay. Thank you very much.